All right, I am here to discuss my patient Ben Johnson, a 22-year-old male newly diagnosed with diabetic ketoacidosis and type 1 diabetes. Some background and disease development include genetic factors. His family history is unclear. The patient mentions his mother is possibly taking medication for diabetes, though, as she takes pills for sugar. And his diet does include regular binge drinking and is high in empty carbohydrates and low in nutrient-dense foods. So Ben presented with symptoms indicative of DKA, such as slurred speech and high blood glucose levels. His condition was exacerbated by his poor diet and substance use habits, contributing to his acute metabolic disturbance. Some medical nutrition therapy interventions that will be used for Ben include insulin therapy, diet education, and alcohol and substance use counseling. Some client needs and recommendations that I have made are going to be in regards to his type 1 diabetes. I'm going to really encourage balanced carbohydrate intake, emphasis on whole foods, fats and proteins, and a regular meal schedule. So managing type 1 diabetes involves a balance of insulin therapy, nutrition, physical activity, and regular blood glucose sugar levels monitoring. A well-planned diet that focuses on balanced nutrition and consistent carbohydrate intake plays a key role in achieving optimal blood glucose control and overall health for individuals with type 1 diabetes. When looking at Ben's chart, I did notice some presence of weight bias. This was identified by Kathy Rhodes, RN. I noticed that she was focusing on the patient's BMI and weight loss despite the acute condition of DKA being the primary concern. The emphasis on weight loss at this stage is premature and may reflect a bias towards the patient's weight rather than addressing the immediate metabolic urgency. When going to Kathy to address the weight biases, I'm going to start by acknowledging her expertise. Then I'm going to highlight concerns that I have in regards to the management of his DKA. I will provide evidence-based solutions, emphasizing and prioritizing the acute management and diabetes education before considering weight loss, and then create some collaborative solutions. So an example of this conversation might be, "Hi Kathy, I appreciate your detailed documentation for Mr. Ben Johnson. I wanted to discuss a recommendation to focus on weight loss based on his BMI of 27.4. Given his acute symptoms of diabetic ketoacidosis, I believe prioritizing his acute management and new diabetes diagnosis would be more appropriate. Once stabilized, we can consider weight management if needed. This approach would help avoid any potential perceptions of bias and ensure patient-centered care. Could we revise the note to focus on managing his DKA and diabetes education? I'd be happy to discuss further." Some other strategies that I would like to use to decrease weight bias in my clinic would be to 1. Eliminate clinical recommendations to lose weight. Instead of immediately prescribing weight loss as a solution, healthcare providers can focus on managing acute health issues related to concerns like diabetes, hypertension, or joint pain without making weight loss the primary goal. This approach involves using health-based goals, emphasizing health outcomes, supporting behavior change, and using personalized care. A second one would be to shift the focus from weight to overall health. So this strategy involves looking at health holistically and addressing various lifestyle factors, substance use, and balanced diet that contribute to overall well-being rather than solely concentrating on weight. This approach encourages lifestyle modifications to adopt healthy behaviors, addressing substance use, providing nutrition counseling that emphasizes mindful eating, and developing a healthy relationship with food, and providing regular monitoring. Thanks for listening.